Test your Fmge, previous year questions knowledge. Part 2. Identify vitamin deficiency in given image. Vitamin B3 niacin deficiency. Identify the image, demographic transition model. Identify the content in this. Contraceptive, nonoxynol 9. After emergency tracheostomy, patient presented with surgical emphysema. What is the most likely reason? Tight suture around tracheostomy site. Which fungal infection is most commonly seen in maxillary sinus? Aspergilloma. 62-year-old diabetic male with severe pain in ear and granulation with discharge in external ear. On examination, patient has facial nerve palsy. What is the most likely diagnosis? Malignant otitis externa. A post-COVID pint presented to OPD with progressing black nasal discoloration. Patient was diagnosed as a case of mucormycosis. Which of the following can be provided as a therapy? Amphotericin B. A 35-year-old patient presented with complaints of vertigo on loud sound and blowing of nose. What is your diagnosis? A. Labyrinthitis. B. BPPV. C. Vestibular neuronitis. D. Meniere's disease. Meniere's disease. Bone-anchored hearing aid BAHA is used in which of the following condition? A. SNHL. B. Acoustic neuroma. C. Otitis media. D. Congenital external auditory atresia. Congenital external auditory atresia. 60 years old man with history of chronic smoking. Presented to OPD with unilateral mild recurrent epistaxis, hoarse voice, headache, cough, difficulty in swallowing. On examination, patient has palpable cervical lymphadenopathy. What would be the most probable diagnosis? Nasopharyngeal carcinoma. Which of the following is used in blood spillage? Sodium hypochlorite. Man had a fall from height and landed on outstretched hand. The patient was found to have fracture of clavicle. What is the most common location for this fracture? Where can this fracture be? A. Junction of medial 1-3 road and lateral 2-3 road. B. Junction of medial 2-3 road and lateral 1-3 road. C. Junction of middle 1-3 road and medial 1-3 road. D. In the middle of clavicle. Junction of medial 2-3, lateral 1/3. A patient presents with mandibular hypoplasia. A boy has hypodeveloped mandible and small chin. This can be due to defect in A. First arch. B. Second arch. C. Third arch. D. Fourth arch. First arch. Insulin stimulates glucose uptake by cells via GLUT4 is an example of A. Primary active transport. B. Secondary active transport. C. Simple diffusion. D. Facilitated diffusion. Facilitated diffusion. Most common macrocytic anemia in India? A. Sideroblastic anemia. B. Thalassemia. C. Alcohol-related. D. Chronic infection. Alcohol-related. A boy presented to OPD with voracious appetite and overall swelling of different body parts. He is most likely suffering from A. Marasmus. B. Kwashiorkor. C. Marasmic kwashiorkor. D. Bulimia nervosa. Kwashiorkor. Which of the VIT deficiency is most likely to cause tingling sensation? A. Thiamine. B. Riboflavin. C. Niacin. D. Pyridoxine. Which of the following type of hexokinase is most likely to be released from hypothalamus? A. Hexokinase I. B. Hexokinase 2. C. Hexokinase 3. D. Hexokinase 4. Hexokinase 3. Peripheral conversion of T4 to T3 is done by A. Deodenase. B. Tyrosinase. C. Throid peroxidase. D. TRH. Deodenase. Which of the following is true regarding Michaelis-Mentone graph? A. Kilometers is directly proportional to substrate concentration. B. Kilometers is directly proportional to enzyme concentration. C. Kilometers is inversely proportional to substrate concentration. Thiamine. D. Kilometers has no relationship with substrate concentration. Kilometers is directly proportional to substrate concentration. Which of the following would help in explaining mechanism of atrial natriuretic peptide? A. CAMP. B. CGMP. C. IP3-DAG. D. JAK-STAT. IP3-DAG. NF1CAFA your late spots pattern of inheritance. A. AD. B. AR. C. XLR. D. XLD. Autosomal dominant. Couple is trying to have a child for past 2 years. After unsuccessful trials, they went for respective examinations. The investigations for female came out to be absolutely normal, but male shows presence of a gynecomastia, the scanty pubic hairs, C. atrophied testes. Comment on the diagnosis. A. Turner syndrome. B. Down syndrome. C. Klinefelter syndrome. D. Edwards syndrome. Klinefelter. Myasthenia gravis is which type of hypersensitivity reaction? A. Type 1. B. Type 2. C. Type 3. D. Type 4. Type 2. Dystrophic calcification is seen in A. Hyperparathyroidism. B. Atherosclerosis. C. Vitamin D disorder. D. Hypercalcemia. Atherosclerosis. Young patient who has familial history of bipolar disorder. His father has now come to OPD with symptoms of mania. His genetic testing shows positivity for recessive inheritance of genes involved in mania. Which of the following mood stabilizer can be given to him as most effective treatment? Lithium. Patient suffering from neck and head cancer is planned to receive radiotherapy. Which of the following anti-cancer drugs can result in increase in risk of toxicity caused by radiation treatment? A. Cyclophosphamide. B. Cisplatin. C. Bisulfan. D. Procarbazine. Cisplatin. A patient suffering from bronchial asthma comes to you in a. All of the following drugs are treatment modalities in management except A. 4-hydrocortisone. B. Nebulization by salbutamol. C. Oxygen therapy. D. 4-magnesium sulfate. 4-magnesium sulfate. T2DM. What products will rises in blood? A. Blood glucose levels. B. Blood insulin levels. C. Blood ketone levels. D. None. Blood glucose level. Patient with glaucoma and also suffering from bronchial asthma. Which of the following anti-glaucoma drugs should be avoided? A. Timolol. B. Pilocarpine. C. Cartilol. D. Brimonidine. Timolol. Chronic alcoholic patient with CLD presents with sudden onset hematemesis. Which one of the following is most likely? Cause? A. Mallory-Weiss syndrome. B. Esophageal bleeding varices. C. Perforation peptic ulcer. D. Boerhaave syndrome. Esophageal bleeding varices. A person brings his father, who is unconscious while working in hot sun in 44°C in June afternoon. Which of the following will not be seen? A. Headache. B. Sweating. C. Hypotension. D. Nausea. Sweating. Treatment of hypothyroidism in first trimester is A. PTU. B. Carbamazole. C. Methimazole. D. Lugoliodine. Which of the following drug is best for urate-lowering therapy in tumor lysis syndrome to prevent renal damage? A. Furosemide. B. Febuxostat. C. Allopurinol. D. Rasburicase. Rasburicase. A diabetic pint is brought with complaints of vomiting and abdominal pain. On examination, patient is found to have hyperventilation and hypotension. Blood glucose is 320 mg DL and urine ketones positive. Next step in management: A. 4-insulin drip. B. 4-sodabicarbonate. C. Check blood ketone levels. D. IVF. IVF. DOC for Legionnaire's disease. A. Azithromycin. B. Tigecycline. C. Kanamycin. D. Streptomycin. Azithromycin. A patient presents with unstable angina and 325 mg aspirin given. Which is the correct MOA? A. Antiplatelet. B. Antithrombotic. C. Fibrinolytic. D. Inhibits cyclooxygenase. Antiplatelet. A female washing clothes and her hands in cold water exhibit color change from white to red. Which of the following drugs is best suited for this patient? A. ACEI. B. CCB. C. Thiazides. D. Beta blockers. CCB. A patient is identified as having tumor in ileum and leading to urinary 5-HIAA being elevated. Diagnosis: A. Carcinoid tumor. B. Neuroblastoma. C. Leiomyoma. D. Chromophenoma. Crinoid tumor. When does handedness get established? A. 6 to 12 months. B. 15 to 18 months. C. 36 to 40 months. D. 36 to 40 months. Dullness to percussion and decreased breath sounds near the base of left lung infrascapular location is seen in which of the following conditions? A. Cardiac tamponade. B. Chronic pulmonary pericarditis. C. Pulmonary embolism. Question D. 46. Left-sided pleural effusion. Cardiac tamponade. Baby was born limp and having apnea. What will you do next? A. Do CPR. B. Give oxygen. C. Umbilical vein catheterization. D. Bag and mask ventilation. Bag and mask ventilation. Pearly white lesions with foamy appearance are seen in the sclera of a child. Which of the following other symptoms are related to the deficiency of the same micronutrient causing the mentioned lesion? A. Conjunctival xerosis. B. Angiostomatitis. C. Glossitis. D. Photosensitive rash. Conjunctival xerosis. What is the most common seizure found in the age group 2 years? A. Febrile seizure. B. Tonic-clonic seizure. C. Petit mal seizure. D. Myoclonic seizure. Febrile seizures. Which of the inhalational anesthetic uses special vaporizer? A. Desflurane. B. Sevoflurane. C. Isoflurane. D. Halothane. Desflurane. As per MTP Act 2021, opinion of 2 doctors is required for A. 12-20 weeks pregnancy. B. 20-24 weeks pregnancy. C. 12-24 weeks pregnancy. D. 20-26 weeks pregnancy. 20-24 weeks. Grievous hurt is said to be there if the person is in severe body pain, unable to follow ordinary pursuits for minimum. How many days, weeks? A. 16. B. 18. C. 23rd week. D. 25. 20 days or 3 week. Which test is used to differentiate species of a blood sample whether sample belongs to human or animal? A. Teichmann. B. Takayama. C. DNA-based method. D. Barberios. DNA-based method. A substance abuser was found on roadside with pinpoint pupils. Which of the following should be suspected? A. Morphine. B. Cocaine. C. LSD. D. Cannabis. Cocaine. In an injury, it is noted under microscope that hair bulbs were crushed. Most likely the injury
Next
is
part
A.
3 dot
abrasion.
in another video.
B.
Please like,
incised
subscribe,
wound and
C.
comment your scores
lacerated
out
wound.
of 50. D. Stab wound. Lacerated wound.